The first video is about hand washing and surgical hand scrub. For easier access and have an organized way while also saving time while doing their procedure. Nails, jewelries, and cuts are places where microorganisms can harbor or enter, so assessing the hands would help minimize the transmission of microorganisms. To prevent transfer of microorganisms and protect the healthcare provider from any contact of bodily fluids. Warm water removes less oil on the protective skin. Running water from fingertips to elbow allow the microorganisms to be washed downwards onto the drain and not letting it back towards you. Holding the hands higher than the elbows during this hand wash maintains the principle of asepsis and from area with lesser microorganisms to more microorganisms. Using the friction or rubbing motion facilitates the removal of microorganisms mechanically, and by using different hand washing techniques, it ensures all surfaces of the hands, palms, and wrists are clean. To completely wash off microorganisms and liquid soap that has been used. Readying or preparing the brush and nail cleaner allows for saving time and more organized way during the procedure. Using nail cleaner allows the removal of dirt under the nails. Scrubbing individually and thoroughly allows all areas of the hands, even the fingers, to be washed properly. Using friction or circular motion removes the microorganisms mechanically. Scrubbing individually and thoroughly allows all areas of the arms to be washed properly. Dividing into areas or plane allows for easier and more organized cleaning in all areas of the arms. Using the friction or rubbing motion facilitates the removal of microorganisms mechanically. Discarding the contaminated brush prevents microorganisms from soiling the hands. This process avoids soiling or contaminating the hands after scrubbing. It also allows the flow of the water from least contaminated to the most contaminated area. Dripping hands on the floor may spread microorganisms or harbor microorganisms. Going to the sterile area after hand washing maintains the principle of asepsis as well as keeping the hands elevated and at waist level only to prevent contamination. Dry the hands to prevent moist or wet hands that may produce chapped hands or lesions easily and where microorganisms could also thrive. Do not touch anything outside the sterile field to maintain the sterility of the hands or your area. Dropping the towel to the proper receptacle facilitates proper disposal and prevents spreading of unwanted contamination. The second video is about donning a sterile gown and closed gloving. Preparing the equipment beforehand makes it organized, saves time, and allows the procedure to run smoothly. Surgical attire prevents the healthcare workers from any contact on microorganisms. Hand hygiene reduces the transmission of microorganisms. Checking the expiration date and condition of the sterile gloves guarantee the sterility of the procedure. The outer wrap is considered unsterile while the inner wrap is sterile. Scrubbing of the arms and hands reduces the number of microorganisms. Identifying the inner surface of the gown allows for easier access. It is also considered unsterile while the outer surface of the gown is considered sterile. Carefully insert the hands and allows the arm to work its way without forcing to prevent contamination. Having a co-worker help you helps a more thorough and easier gowning without contaminating by yourself. Tying the gown with the help of the co-worker helps secure the gown properly and completely. Putting on gloves helps prevent contamination or transmission of any foreign droplets or blood to the skin and the patient. Inner sterile gloves are considered sterile and can only be touched by sterile areas or things. Putting gloves first on non-dominant hand allows easier insertion of the gloves. Sterile hands must also only touch the sterile parts of the gloves to prevent contamination and vice versa. Putting gloves on dominant hand with the help of sterile non-dominant hand allows easy application. Only sterile area of the hands must touch the sterile area of the gloves and vice versa to prevent contamination. Adjusting the gloves for fit and comfort allows the healthcare provider to work with ease. Maintaining sterility allows for prevention or transmission of microorganisms and infection. That's all for the perioperative return demonstration. Thank you and God bless!